For women who say a male nurse made them feel extremely uncomfortable at Kaiser Permanente's medical offices in Beaverton filed a $5.75 million lawsuit Monday. The women say Kaiser didn't do enough to stop nurse Alex Woolner, 39, who was the subject of complaints from other female patients around the same time he treated them in early 2016. Woolner ultimately lost his job and was prosecuted for sexually abusing at least 5 women at the Kaiser's Southwest Western Avenue location in early 2016. He was sentenced to 2.5 years in prison earlier this year. The 4 plaintiffs, not among the women whose cases resulted in the abuse charges, offer detailed accounts, saying Woolner stared at their breasts or buttocks, unnecessarily exposed parts of their bodies, or touched them in unsettling ways on the upper arm or thigh. Their experiences have left them feeling violated and nervous about being in medical offices, said Portland attorney Greg Kafuri, who is representing the women. They all have levels of anxiety about getting medical care, especially from men, Kafuri said. Kaiser Permanente spokesman Mike Foley issued a statement Tuesday, stating that the company has updated policies, implemented training for staff, and improved investigative procedure. The safety of our patients is our highest priority, and we have no tolerance for behavior that puts patients at risk, read the statement. We are dedicated to ensuring that our care centers are safe and welcoming places of healing. One of the plaintiffs in the lawsuit says Woolner claimed he couldn't find a hospital gown that would fit her, so he had her take off her top and expose her bra while he gave her immunizations. According to the lawsuit, Woolner told her she was well endowed and had nothing to be ashamed about. The suit also states that Woolner said he was surprised she was wearing a fun bra instead of a sports bra because it is more often preferred by women with large breasts. The suit says Woolner told the patient she could work as a nude model and told her to send naked photos of herself so he could help her get work because he had previously worked in that field. Another plaintiff, who went to Kaiser for travel vaccinations, said Woolner put his hand on her thigh, then gestured toward his inner thigh area and said the muscles around it were sensitive, according to the suit. Woolner questioned the woman about body piercings, and when she said her nipples were pierced, he told her he had pierced genitals and that his piercing once had become caught with his partner's piercing during intercourse, according to the suit. Kafuri said 2 of the 4 plaintiffs complained to Kaiser. 3 spoke to police. But Woolner wasn't criminally prosecuted for any of his interactions with the 4 women, Kafuri said. 2 were treated by Woolner before and 2 were treated by Woolner after Beaverton police began investigating him, according to dates outlined in the lawsuit. The investigation started after a woman first went to Kaiser and then on January 28, 2016, went to police to say that Woolner had inappropriately touched her and made sexual statements during a clinic visit 2 days earlier.